Hi, I'm Dr Houda and
Hi, I'm Dr Ali Youssef.
we're from Greenacre Sports Medicine Clinic, and welcome to our very first podcast, guys. Hope you like it. We're going to be talking about all things pain and health and longevity and well-being. So tune in and let's follow along. So
Who are we?
Who are you? Introduce yourself, Ali.
Dr. Ali Youssef, osteopath at Greenacre Sports Medicine Clinic. Been in practice since 2006. The clinic has evolved over the past 20 years. Initially, we called it Greenacre Sports Medicine Clinic.
Yeah, we did, didn't we?
And it's taken a different path completely. One of my strengths that I've kind of built up on over the years was the ability to solve complex pain problems. And what I found was there was a lack of continuity in treatment. There was a lack of clarity with patients who were suffering pain. So what would happen was, by the time they came around to us, they'd been suffering for months, but the majority years.
Yeah.
So the common pattern is, I'd ask them, how long have you had this for? And it's 1 year, 2 years, 7 years, 9 years.
With their pain.
And as we go through their history, it's just poor management and poor clarity, time after time. They'd see a clinician 2 or 3 times. And the question is, why only 2 or 3 times? It's like, that's all they gave me. Or that's all they said I needed. Or some would discharge saying, I don't know what to do. You're going to have to deal with this. This is a long-term thing.
Yeah.
But the reality is that's not the case.
Yeah.
So that gap is where I decided, or I felt like I could do something and make an impact.
Yeah.
And over the years, we've become really good at it.
Yeah.
And so it's, by name, it's Greenacre Sports Medicine Clinic, but by specialization, we actually treat complex spine-related presentations.
Yeah, complex back pain.
Really complex.
We ended up thrown into that department.
And I love the challenge.
Yeah. Well, we saw that gap, like there was that massive gap of patients not, like you said, not having clarity, not having direction with their pain, patients being passed from one practitioner to another. And then we realized that we had the knowledge and the experience to solve that specific niche of problems, which complex back.
And the truth is, it's not that difficult.
Yeah.
It is not that difficult. But I don't think people or clinicians give that person suffering the time they need to create that clarity. And this is where we come in.
Yeah.
And this is what's kept us going. And this is what's allowing us to help as many people as possible.
Yeah.
And this is my mission. My mission is to be able to impact as many lives as I can.
Yeah.
Through my work.
Yeah.
And so this is why we're here.
Okay.
And so the whole purpose of this is to hopefully be able to reach out to as many people who are suffering with chronic pain or long-term spine-related injuries, who require clarity, who require a plan, who requires structure, and simply to be seen, heard, and understood. That's it.
That's so important.
That's it. That's what we do.
Yeah.
And so I might allocate 30 minutes and it just usually goes over because the person needs sometimes a little bit more time. It really triggers the admin at the front because they're always in damage control. Ali's running late.
You are well known for never running on time.
That's my trademark. So if you rock up on time, just
so as a
grab a
team,
seat,
we apologize in advance.
Get comfortable. Trust me, it's worth the wait.
Yeah.
We will get to the bottom of your pain.
Yeah.
And we will create clarity and a plan.
Yeah.
And that plan usually doesn't just involve me. It's an integrated plan.
Yeah.
It might require you going back to your doctor. It might require you seeing an EP, another physio who specializes in spine-related rehabilitation and pain.
Yeah.
But what we do is we understand what they're presenting with, and we give the patient clarity, we answer their questions and give them guidance. So
it's a team effort, really.
it has to be. It has to be. And an approach cannot be just single faceted. So it can't be go and do these exercises or take this medication or have this injection. What I've found over the years is the more modalities you stack together, the bigger the impact. So let's say, for example, the patient rocks up and he's talking about his pain or she's talking about her pain and it's a 9 out of 10. Sometimes the medication is necessary to modulate the pain, to allow them to sleep. If you can't sleep, you don't heal. That's the bare crux of it. So we need them to be able to function as best as possible with that severity of pain. And so it has to be a multifaceted approach. Some patients don't like medication, so we've got a natural approach. We use practitioner-only products that are proven and tested. Exercises, for example. They come in with, I swear, the weirdest exercises that they've picked up from YouTube and TikTok. And some purchase subscriptions and programs.
Some coaching program that's not specific for their condition.
And all they probably just need to do is walk. Just to move. Within their pain capacity, within their limitations. And this is where we create clarity and say, not now. This is what you do now. We'll get you through this phase. And as your pain starts to regulate and modulate and we can bring and calm your nervous system down, then we transition onto different types of exercises. And to keep it even simpler, we're just trying to get you moving as safely as possible. That's it.
Everyone needs to move.
As safely as possible. You want to heal, you need to move.
You have to move. So that bed rest, old school advice, it doesn't apply anymore. We know that movement and mobility within the patient's capacity and limits is going to facilitate them to get better faster. They're just going to get better quicker.
You need to move.
You can't be in the bed. You can't be laying down all the time. You can't be on the couch when you have active pain.
And so the question is, which is better for me, or should I do this or should I do that? Really, it's dictated by the person's phase that they're in their healing process, the amount of pain that they can tolerate. So we want to get them moving with minimal to no pain. And so if land-based exercises are too painful, then on your back, some type of movement on your back. And if that's too painful, in the water. So hydrotherapy, the whole reason that is prescribed is because it creates a weightlessness and it allows them to move. Remember the core purpose is to get you moving. It allows them to move with the least amount of pain.
But how out of fashion is hydrotherapy now, which is so sad. I think hydrotherapy is brilliant. I mean, I taught it for so many years to my patients.
Powerful.
And it changes lives, really, when you can't walk and do much on land, but you go into the water.
Everything
and then
changes.
You're just so light and you can move and we can mobilize patients and get them active again.
And some of the fun facts about, for example, hydrotherapy is, let's say you're half submerged in water, you're carrying half your weight. Let's say you're submerged to your shoulders, you're literally carrying 10% of your weight. So it's weightlessness. So there's no compression. The compression from the water, the hydrostatic pressure on the body, improves blood flow, improves lymphatic drainage, and overall it allows them to move safely and comfortably. And it facilitates the healing process. Does it speed up the healing process? No. It facilitates. It allows movement in a safe environment, which promotes healing, which is what we want. And another thing patients tend to want is they want a quick answer. They want a quick fix.
For chronic back pain.
For chronic back pain. For pain. If I could deliver that, you'd see me dressed up as a wizard.
You'd be a wizard, definitely. I need to get you a wand.
With my crystal ball and some potions, but it doesn't exist.
Yeah.
Healing is, your body does its own healing.
Yeah, and it's not linear. It just doesn't heal in a straight line.
No.
So many variables to healing.
Too many variables.
Yeah.
So the human body is capable of doing its own healing.
Yeah.
And all we have to do is give it the space to heal.
Mm-hmm.
And this is what a lot of patients do not do.
Yeah.
So they'll try to speed up the process and try to push through. And
do you think it's a cultural thing or a gender-based thing that people tend to put themselves on the back burner and not address pain in real time? Or do you think that they're just not getting clarity? Or do you think there's not enough education or awareness around pain?
First thing is they don't know.
Mm.
So they're basing it on Google searches, now AI.
Chat GPT.
Giving them bogus solutions. Their mates are telling them what to do. I tried this, take it. You know, we know what's going around these days, bloody peptides. So if you want to be a guinea pig for these peptide companies, yeah, jump on it. Hasn't been proven or tested. I wouldn't touch it. Seen so many adverse reactions in patients. And if you look at the person giving it to you, ask what their profession is first. Half of them are IT guys, have no idea. Did a few Google searches and a bit of research. Now they're experts. What's your man Ush guy? You know, makes pizzas and now sells peptides on the side.
Yeah. The issue is not with peptides being wrong. The issue is with the quality of the peptides that are coming out and not tested. It's not that peptides are bad or we don't believe in peptides. True. Peptides have a huge, huge future, I believe, and they have, had a lot of people benefiting from them. But the issue is the purity and the quality of the peptide, not so much the peptide themselves or the outcome of the peptide.
The modality, the approach, the science, amazing.
Yeah.
The product on the market, tainted.
Yeah.
That's what's out there.
Yeah. It's hit and miss, I think, sometimes.
More miss than hit.
Yeah.
So they don't even know what the dosing is.
Yeah.
So what's the right dosing for this stack of peptides?
Yeah. Especially when they're putting lots of different ones on top of each other as well.
Yeah. And there's no way to monitor actual progress.
Yeah.
Some are trying to do it, but it's still poorly regulated. It hasn't been proven. Hasn't been approved by the TGA.
Yeah.
So if they haven't approved it, and the TGA are quite rigorous in their approvals process.
Yeah.
So they're looking after our best interest for them to approve a medication. Just wait.
Yeah.
It's not far.
Yeah.
You know.
When I approached my endocrinologist about peptides, he just gave me that look. He's like, Houda, I don't want to know about it. I don't want to hear about it.
Yeah. Not yet.
Yeah.
It's coming.
Look, everyone has a different level of comfort with peptides as well. And some people, they're happy to take that chance, take the risk if they're comfortable with the person supplying it to them. And that's the reality. If you know someone and you know they've tested it or they've done some research on it or they're sourcing it from somewhere that they're comfortable with and you feel comfortable with that, then at the end of the day, everyone can make their own decision about their own health.
Yep.
Right? But in terms of, quality and testing, there needs to be definitely more regulation around that.
And so patients do ask, and it is at their own risk that they use it.
Yeah. And like we said, we're not anti-peptide.
No.
Definitely not anti-peptide, so that has to be super clear. We're anti you not knowing where it's coming from, how effective it is, has it been tainted with anything, you just not knowing. And what are you putting in your body? Yep. This is what we're anti. We're not anti the peptides themselves.
No.
Because there's so much future for peptides.
Yeah, agree.
So that's why I thought I'll give clarity around that.
Yeah, that's good.
Yeah, so anyway, what else do you want to tell us about you, Ali?
Talk about yourself for a little.
Yeah.
Who is Houda?
Who is Houda? Well, I'm Houda Omran and I'm an osteopath, as you know, and I'm actually your wife. So a lot of people don't know that we're married. People come into the clinic because we have different surnames and they never associate the fact that we're married. And then they're like, How do you guys work together? How do we work together, Ali?
How do we work together?
We work really well together because we actually mostly don't see each other at work.
That's the truth. She's there, but she's not there.
We're too busy, you know.
Yeah.
It's like a hi bye in the hallway.
Might see you in passing.
See you passing. Our lunch breaks are completely different. Our whole schedules are completely different.
Yeah.
But I mean, we started as friends, you know, before we got married. So we sort of had that comfort with each other. And then we sort of knew where each other's boundaries were from friendship,
True.
you know. And we've been married for 20 years now as well. So like a prison sentence.
That's a stretch. No, it's good.
Yeah. And then we're both osteopaths, right? But we differ on a lot of different things.
We agree to disagree.
We agree to
a lot
disagree.
of the time.
So I do things a little bit differently. You do things a little bit differently. But I think that's what makes us unique, right?
We get to bounce our ideas off each other, and I'll disagree with you and say, give this a try.
We can
You'll
agree.
disagree with me, and
then
you
we
say,
can
Ali,
clash.
give this a try.
And then we can agree sometimes.
Yeah.
But that's what makes it unique, right?
Yeah.
So with me, going back to the name Greenacre Sports Medicine Clinic, that's originally what we did a lot of, like sports injuries and, you know, soccer players, footy players, swimmers, gymnasts. We used to see lots of those.
Cyclists, the whole lot.
Yeah.
The whole
And then we realized that there was that massive gap of no one really specializing in chronic back pain. And it wasn't something we thought we wanted to specialize in. It was just something that
Evolved.
And
But I think, like for me, I think it's the energy we put out there, right? I love a challenge. And so they're the kind of patients that were drawn towards us, or to me. And so if a patient's presentation wasn't too challenging, they were treated a few sessions and see you later.
And they're good, yeah.
See you later. And then, but the complex ones were the ones that really got my brain ticking.
Yeah.
Got me doing research, got me asking why.
Yeah.
You know, and I love that.
Yeah.
I love asking why. I love a challenge.
Yeah.
And this is why we are where we are at the moment.
Yeah. And I think the one big thing we do have in common, you and I, is we have an obsession with solving problems. Like,
Fixer.
if there is a problem, I'm going to just obsess over it until I solve it. As long as it's not a maths problem. Because me and maths, we don't go well together.
Yeah.
Me and humans, great. Chronic pain, great.
You are the definition of girl maths when it comes to maths.
Give me a complex problem to solve. Do not give me maths equations, man. I did not do well at maths at school. But that's okay, kids. You don't need to be great at maths to be successful in life. So
Don't say that.
I'm living
Some parents
proof
are going
of
to be
that.
knocking on our doors.
Well, every child has its potential.
True.
And not every child has super academic potential. Some of us, our brains work differently. So I think we fixate, you and I, on solving problems, and that's, I think, what led us down the pathway to chronic back pain, because it was tough to solve in the beginning. And then it led us to like the decompression, and then seeing other patients benefiting in other clinics from decompression, and then piquing our curiosity. And I remember you sending like bunches and bunches of patients
That
to
story,
that clinic.
yeah. That one guy, so much gratitude for him, but tried everything.
Yeah.
Tried everything. You know, we were working together, you know, myself, and he was working with the physio, and he was doing his hydro. It's failed back surgery.
He'd had one or two back surgeries by that point. He'd had his first one, I think.
He had his first, was ready for his second, and we were trying, and he was trying everything,
Yeah.
and it was debilitating.
Yeah.
He could barely walk from his car to the treatment room.
I remember you telling me about that patient at the time. Like, Houda, this patient, like it's...
I was fixated on that, and I wanted to find a solution, but everything that was out there with the research and the evidence, and I'm a skeptic of most evidence-based research studies.
Evidence?
Even with evidence?
You need real life evidence.
I need real life case evidence. You know, it's reading it on a piece of paper. I use that as a guide, like a compass. You know, Ali, don't go this way, go this way. It's a little bit better.
Yeah.
That's research. Do I take that research and apply 100% in clinic? Hell no. Each individual is their own unique person.
Yeah.
And yeah.
And then that patient brought you the solution. Well, he
Yeah.
opened your eyes to that
He
solution.
opened my eyes to it. He goes, Ali, take a look at this. I did spinal decompression and I'm back to cycling and there's no more pain. Like, what is this?
Yeah.
And so I went down that rabbit hole for about 2 years.
I remember we're having these conversations about it.
And there was no evidence.
Yeah.
All the evidence that was out there was shit.
Yeah.
But the clinical evidence was
It changed his function.
changing lives. Like, it's like, there's no clinical evidence, but look at this guy. And I'm like, all right. So I'm going to send all my complex lower back and neck patients to the closest person with this actual treatment table.
Yep. I remember you doing that.
And it got to a point where the person said, stop sending patients. She was so busy.
Yep.
It's like, I can't take on anymore.
Yep.
And then I would reach out to the patients frequently to see how they're progressing. And I was in close contact with her. And the results were amazing.
Yeah.
Amazing.
What were the biggest impact that you realized was happening with these patients after they did the decompression programs with the other practitioner?
What was the biggest impact on their lives?
Yeah.
They regained most of their function.
Yeah.
Is it a 100% fix? No.
Yeah.
Are there patients that it doesn't work for? Yes.
Yeah.
And this is where the clinical assessment is crucial.
Yeah.
We'd have to look at their scans, the clinical assessment. We treat them first, see how they respond. Some patients are beyond the spinal decompression,
too late for them.
non-surgical spinal decompression. And the only way is surgery.
Yeah.
And in the past, I'd say 2 weeks. No, in the past month, I've had 2 patients that I've said, this is beyond.
Yeah.
This is actual surgery.
Yeah.
And each person has their place. And with the clinical assessment, we can determine whether we can help or not. And some patients, it's so far gone, or not even so far gone, but there's so much damage that we can get them to a certain level of improvement in function. But they also need to understand that this may be their ceiling.
Like the limit.
Yeah.
Yeah.
And if they're happy with that, we're happy with that. And if
Yeah.
they're not, then maybe surgery.
Yeah.
And even surgery is not guaranteed as well.
That's
so
true.
it's a difficult decision to make for both us and for the patient. But the question was, what is the biggest impact? They regain their lives. And for the majority of them, I would say 60 to 70%, most of their function returns. So a good 80, 90% of their function returns if they follow the protocol. So this took us 5-6 years to develop as well.
Yeah.
So we took everything that we know and we had to weave into it spinal decompression and make it fit an actual protocol and a process
Yeah.
that achieved the outcome that the patient wanted.
Yeah.
And so there's not just a one lane approach, just decompression. No, we had to integrate manual therapy. We have to integrate exercise. We have to
Yeah.
integrate the nutritional components.
Yeah.
And in some cases, they need to see a psychologist
Yes.
because they've been in so much pain for so long that there's a huge psychological component.
Yeah.
And we need to be able to identify that as well.
Yeah.
So sometimes the first step is not manual therapy. It's
Yeah.
actually getting them to see somebody to help them regulate their nervous system on
Yeah.
a psychological.
Correct. Especially if there's been like old trauma, emotional trauma, physical trauma, relationship trauma.
And-
Our body holds the score.
Yeah.
Definitely holds
Yeah.
the score.
Yeah. Our body is like a big storage unit, memory database of all your experiences, all your fears, all your traumas, all your joy. And it shows in your body and the way you carry and the way you move. And that impacts the experience of pain. that can either amplify their pain, which it usually does. It's like adding fuel to a fire. Or it could actually alleviate their pain.
Yeah.
So if they're in a good state, things do improve a lot faster.
Yeah.
So
Humans are not just physical bodies.
no.
Their mind, they have a body, they have a spirit, they have a soul. And all of these components are important.
Yeah.
You know, hope, faith, movement, you know, functionality, relationships. All of these things can impact on the way pain is perceived, the way pain is processed for them, you know, where their pain limits are, thresholds. Like I have some patients who are having so much trauma in their body that even if I do like light soft tissue work, light work, they can be in pain for days, especially if there's underlying fibromyalgia, complex regional pain syndrome. You know, they throw a spanner in the works.
Which have a strong psychological component.
Yes.
Those two?
Yeah.
Strong psychological component. And so if you don't address that, massage till the cows come home, nothing's going to change.
Yeah, whether you can't decompress that, you can't massage that, you can't
exercise that.
You can't exercise that away. There definitely needs to be like a psychological, a team.
Yeah.
It's a team-based approach, I think, for patients.
100%, I agree, yeah.
Thank you so much for listening, guys. You can follow us on our YouTube or our Spotify where we're going to have our podcast. And if you have any questions or any topics, definitely pop them in the comments below. Thank you.